All right, let's dive into the common causes of nasal infections, which can ultimately lead to sinusitis. There are three main culprits: viruses, bacteria, and allergens. First, let's talk about viruses. Viral infections like the common cold or flu can cause inflammation in the nasal passages and sinuses. This inflammation can obstruct the flow of mucus, leading to sinusitis. Most cases of sinusitis are actually caused by viral infections, and they usually resolve on their own within a couple of weeks. Now, on to bacteria. Bacterial infections can also cause sinusitis, but they're not as common as viral infections. When the sinuses get blocked due to inflammation from a viral infection or allergens, it creates a perfect environment for bacteria to thrive. This can lead to a secondary bacterial infection and acute sinusitis. If left untreated, bacterial sinusitis can become chronic, lasting for more than 12 weeks. Finally, allergens play a role in causing nasal infections and sinusitis. Allergic reactions to things like pollen, dust mites, or pack dander can cause inflammation in the nasal passages, leading to sinusitis. In some cases, chronic sinusitis can be triggered by ongoing exposure to allergens. In summary, nasal infections and sinusitis can be caused by viruses, bacteria, or allergens. These factors lead to inflammation and mucus blockage in the sinuses, creating an environment where infections can develop and persist. Moving on to the body's natural defense mechanisms and immune responses to nasal infections. Our bodies have some fascinating ways of dealing with infections, including inflammation and mucus production. Inflammation is our body's first line of defense against infections. When harmful substances like viruses, bacteria, or allergens enter our nasal passages, our immune system responds by increasing blood flow to the affected area. This results in inflammation, which helps to bring more immune cells to the site of infection. In the case of sinusitis, this inflammation can cause the nasal passages and sinuses to swell, making it difficult for mucus to drain properly. Now, let's talk about mucus production. Mucus is a sticky substance that lines our nasal passages and sinuses, acting as a protective barrier against harmful substances. It helps to trap and remove foreign particles, like viruses, bacteria, and allergens, from our respiratory system. During an infection, our body produces more mucus to help flush out the harmful substances, but this increased mucus production can also contribute to the blockage of the sinuses. So, while inflammation and mucus production are essential parts of our body's natural defense mechanisms against nasal infections, they can also contribute to the development of sinusitis. It's a bit of a double-edged sword, but these processes are crucial in helping our immune system fight off infections and keep us healthy. Now let's discuss the typical symptoms of sinusitis and how they can impact daily life. Sinusitis can be quite uncomfortable, with symptoms ranging from nasal congestion and facial pain to headaches. One of the most common symptoms is nasal congestion. When the sinuses are inflamed and filled with mucus, it becomes difficult to breathe through the nose. This can lead to mouth breathing, which can cause dry mouth and throat, as well as disrupt sleep. Nasal congestion can also affect your sense of smell and taste, making it difficult to enjoy food and drinks. Facial pain is another common symptom. The pressure and inflammation in the sinuses can cause pain and tenderness around the forehead, cheeks, and nose. This pain can become worse when you bend over, lie down, or experience changes in temperature or air pressure. Headaches are also a frequent symptom of sinusitis. The inflammation and pressure in the sinuses can lead to tension headaches, which can be quite debilitating. These headaches often worsen throughout the day, making it difficult to focus and carry out daily tasks. Overall, the symptoms of sinusitis can have a significant impact on daily life. They can cause discomfort, disrupt sleep, and make it difficult to concentrate, which can affect your work, social life, and general well-being. It's important to recognize these symptoms and seek appropriate treatment to alleviate them and improve your quality of life. Let's explore some of the theories surrounding the purpose and function of our sinuses. There are several ideas as to why we have these air-filled cavities in our skull, including humidifying air, enhancing vocal resonance, and lightening the skull. And one theory is that our sinuses help humidify and warm the air we breathe in. As air passes through the nasal passages and sinuses, it comes into contact with the mucus lining, which adds moisture and heat. This process helps to protect our lungs from dry or cold air, making it easier to breathe and reducing the risk of respiratory infections. Another theory suggests that our sinuses play a role in enhancing vocal resonance. The air-filled cavities can act as resonance chambers, amplifying and modifying the sound of our voice. This is why our voice may sound different when we have a cold or sinus infection, as the inflammation and mucus buildup can alter the way our sinuses resonate. Lastly, some experts believe that our sinuses serve to lighten the weight of the skull. The air-filled cavities reduce the amount of bone, making the skull lighter and easier to support. This could be especially important in humans, as our upright posture places more stress on the neck and spine than in other animals. While the exact purpose and functions of our sinuses are still debated among scientists, it's clear that they play a significant role in our respiratory health and overall well-being. Understanding these theories can help us appreciate the complexity of our bodies and the importance of maintaining good sinus health. Now let's discuss the different diagnostic methods and treatment options for sinusitis, which include medications, lifestyle changes, and surgical interventions. Diagnosing sinusitis typically starts with a medical history and physical examination. Your doctor will ask about your symptoms and examine your nasal passages for signs of inflammation and infection. In some cases, further testing may be needed, such as a nasal endoscopy, where a thin tube with a camera is inserted into your nose to view the sinuses, or imaging tests like X-rays or CT scans to get a clear picture of the sinus cavity. Once sinusitis is diagnosed, there are several treatment options available, depending on the cause and severity of the condition. For viral sinusitis, treatment usually focuses on managing symptoms and providing relief, as it often resolves on its own within a couple of weeks. Over-the-counter pain relievers, saline nasal sprays, and decongestants can help alleviate symptoms. It's also important to stay well hydrated and get plenty of rest. If sinusitis is caused by a bacterial infection, your doctor may prescribe antibiotics to help clear the infection. It's crucial to follow the prescribed course of antibiotics to ensure the infection is completely eliminated. For those dealing with chronic sinusitis or sinusitis caused by allergies, lifestyle changes and long-term medications may be necessary. This can include using steroid nasal sprays, antihistamines, and immunotherapy to manage symptoms and reduce inflammation. In some cases, surgical intervention may be required to treat sinusitis. This is usually considered when conservative treatments have not been effective or if there are structural issues contributing to the problem, such as nasal polyps or a deviated septum. Surgery can involve removing polyps, enlarging the sinus openings, or correcting structural abnormalities to improve sinus drainage and function. In conclusion, there are a variety of diagnostic methods and treatment options available for sinusitis, ranging from medications and lifestyle changes to surgical interventions. Working with a healthcare professional to determine the cause and best course of treatment is essential in successfully managing this often painful and disruptive condition.